One important thing I should highlight when you do these first two exercises is that initially you won't see a big of a movement around your cervical spine. You might only see that you're only able to do few millimeters backwards and then few millimeters downwards. That is purely normal. I have seen quite a few patients who have self-diagnosed themselves to have a neck pain or shoulder pain, and when they actually go to the specialist, they are diagnosed with the other way around, and they found were having a neck pain, neck problem versus a shoulder problem, or having a shoulder problem versus a neck problem. Assalamu alaikum. My name is Dr. Adel Iqbal. I'm a physical therapy doctor. Today we are going to talk about neck pain. We're going to talk a little bit briefly about the causes of neck pain and how we can take care of those uh, general symptoms about your neck pain. As a clinician, I won't be able to diagnose your specific problem because I'm not your physical therapist, but we're going to talk in general what are the symptoms of the neck pain, how we can differentiate between a neck pain versus a shoulder pain. There are a few tests which we can do, which can tell us if we are having a neck pain or a shoulder pain, and we're going to talk briefly about it. But the best practice would be that you talk to your clinician and find out exactly what is the root cause of your problem so that can be treated accordingly. The very first test which we can do to differentiate if you are having a neck pain versus a shoulder pain is that you put your own arm, let's say if your pain is on the left side, so you put your left palm on top of your head like this, and you bring your shoulder in abduction. Once you bring your shoulder up there and put your hand on top of your head, if that relieves the pain in your shoulder area or around your neck, it's most likely is coming from your neck. It's not a shoulder pain. And if the performing the same test, as soon as you start bringing your arm up and you start feeling sharp pain in your shoulder and you can't even lift your shoulder up, then probably that cause is coming from your shoulder. Sometimes you can also differentiate between the neck pain and the shoulder pain by the way you feel the pain. If the symptoms of your pain includes some numbness or some paresthesia around your fingers, or part of your arm is kind of a tingling sensations in your arm or around your neck area, or you feel weakness in your hand muscles or your thumb or any finger muscles, that means most probably a nerve is involved. So it is very important to differentiate between the neck pain and the shoulder pain. One of the tests you perform to differentiate a muscular pain versus a radiculopathy pain is that you do a Sperling test. In the Sperling test, what you do is that let's say your pain is on the left side, you put your neck backwards, we call it extension, and then turn your head towards the same side where you have the pain. If causing this movement causes a shooting pain in your neck, so most probably one of the nerve which is coming from your cervical spine is involved in this pain. Again, my idea is not to diagnose your pain at this time. It's just some simple test which can help you differentiate between muscular pain and neurological involvement of these nerves coming out of your cervical spine. It is very important for you to go back to your physicians or your specialist and find out exactly what's causing that pain. Once we find out neck versus shoulder, and within the neck, muscular versus neurological involvement, then we can educate you on certain stretchings and certain exercises to alleviate your symptoms. Now let's talk about some of the stretches and exercises which you can do once you find out that your problem is actually in the cervical spine and it's mostly radiculopathy versus some local muscle pain. So one of the exercises which you do, which we call the chin tucks. So if you look at my chin, if my chin is, I'm going to give you a side view. If you look at my chin, this is my neutral position. Most of the people would sit like that. Most of the people who have neck pains, they are sitting like with this kind of a stooped posture and a curved cervical spine. So what you're going to do is that you're going to pull your chin backwards. So if you can see, this is normally where we sit. You're going to pull your chin backwards. Once you pull your chin backwards, You're going to count to five. One, two, three, four, five, and you're going to let it go. When you do this exercise, you're going to feel the stretch all the way towards the back of your muscles and deep neck muscles over there. So what you do is that you do chin tucks. The next stretch or exercise which you're going to do in the same position is that you're going to do a combination of chin tucks with double chin. Okay, so you're going to pull your chin backwards and then you're going to push it downwards. Normally, if you're sitting like that, it is very easy to bend your neck down and up. But once you pull your chin in a chin tuck position, there's not much room for you to bend your neck. So you can barely go down and then come back up. What you need to avoid is that go too far up like this and then bring it down. So keep your neck straight, and from straight position, just go a little bit down and back. So chin tuck and then double chin and back. Again, when you go down, you can count to five. 1, 2, 3, 4, 5. So you do these exercises. First exercise you can do 10 times, and then you rest a little bit, and then you get to the phase 2 of the exercise where you pull your chin backwards and then push it downwards, and do that again 10 times. One important thing I should highlight when you do these first 2 exercises is that initially you won't see a big of a movement around your cervical spine. You might only see that you're only able to do few millimeters backwards and then few millimeters downwards. That is purely normal because the stiffness in our neck, all those muscles, because of the constant pain, they kind of get shortened and they get tight in there. So you need to start mobilizing them. So if you don't see much movement over there, that is purely normal. You need to keep focusing. As long as you understand the movement, which is backwards and then downwards, in backward position downwards, as long as you understand the movement, you are doing it right. The next few exercises which I'm going to explain you are basically, we call them isometric exercises of the neck. We're going to do the same exercises in my neck. In our neck, we have certain kind of movements. We have forward bending, we have backward, we have side bends, then we have rotations in the neck. These are the major movements in the neck. So we're going to do isometric exercises of each group of these muscles. So like I said, so forward bending, backward bending, side bending to the right, side bending to the left, and then rotation to the right and rotation to the left. So let's start with the side bending first. So what we're going to do is you're going to use the palm of your hand. So actual movement is going to be the side bending to the right. So if my hand is not there, my head will go towards the right. But with my right palm, I'm going to try to stop my head from going to the right side. So I'm going to hold it right here. And over here, you can see in my muscles that my muscles are working on the right side. When I push my head towards the right, this muscle, you can feel it becomes kind of a tight cord on the right side. You are only going to use about 30 to 40% of your strength. Don't push it too hard, your hand, your palm into your head, neither your head into your palm. So very gentle push to the right, and then you rest, and then go on the opposite side and do the push. So in this way, I'm going to be pushing my head to the left, but I'm going to hold with my palm, pushing it towards the right. So, and you can see this muscle over here. Normally it's a soft muscle, but when I push it against that, it becomes tight over here. So this is the side bending. You're going to hold 5 seconds on each exercise, and then you let it go. And 5 seconds on the other side, and then you let it go. And the other thing which you need to make sure that you're doing it is that you are not, as you start your movements, you're not pushing it too hard, and as you stop, don't abruptly just let it go. So gently increase the strength and gently decrease the strength. Now let's get to the third movement of the isometric exercises. We call it the rotation. Rotation, normal rotation, you will be rotating your head to the right, and then you'll go towards the left. But when you want to do an isometric rotation with the same right palm of the hand, So instead of holding it over here, you're gonna close to your front of your forehead, on the side of the forehead, and you're rotating your head to the right, but with your right palm, you're gonna prevent it from happening. So when you do that, now this muscle is not as active versus my muscles at the back of my neck. They are much more active now. You will feel it. So what you do is you do rotation to the right with 5 seconds. One, two, three, four, five. And then you let it go and relax your shoulders down and go on the other side. And you do on the left side one, two, three, four, five, and then you let it go. These are some very basic exercises for the beginners who can do these exercises uh, once a day or twice a day, uh, having making sure that you have consulted your healthcare professionals and there's no serious issues going on in your cervical spine or your shoulder areas. When I say serious issues, it could be cancers, or it could be some infections in your bone, or that kind of situations. Once it's all ruled out and cleared out, you can perform these exercises and then see if they help you or not. Write down in your comments, let me know what you feel about these